Hey, good afternoon, doctors. This is Dr. Kronk with Dr. Pickman. We're very, very happy to be presenting this program to you today, 5 ways to completely blow attorney referral relationships. Both Todd and I are going to be, we've got kind of a looser format. We're going to be talking and we're going to be interviewing, and I've created a slide deck today. We both have a slide deck actually, to kind of show you examples of things and to teach, but also explain at the same time, which is not the easiest thing in the world to do, but that's what we're going to be doing. Before we start, and before we get into it, if you look over to the left of this right here, this is Thursday, so this is 2 days old. So a lot of the stuff I'm going to be showing you and that Todd's going to be showing you is real life, like this is occurring this week. This is the experience that he has this week. This is not sort of the pie in the sky or the things that are not being tested as not working. So if you look here, need Nashville ASAP. You have any? 100 patients a month. Now, of course I do. Here's one doctor that I have. Now, why would this doctor, would I want to set him up for a possible referral, as a possible referral source for 100 new injury patients a month or a portion of that? The answer is really, really simple, because he's top of the line expert for what they need. My status is on the line with the referral. Right now, this doctor's gotten my attention, just like the doctor that's on today has gotten my attention, because they're actively using the information and they're becoming incredibly successful with it. So this is sort of real world. My partner today, Todd Pickman, is a master, an absolute master at duplicating things. Totally, Todd. And I can say that, doctors, because I'm all over the place, and I have been for years and years and years and years. And it's a small amount of time or a small number of acquaintances where I meet somebody where it just clicks. And it just clicks because you're on the same page completely. So, Todd, we said in all these Facebook Lives, hey, there was 5 ways to blow attorney referral relationships. You've been in the market. Why don't you give a little bit of your experience?
Sure.
And we'll take over from kind of an interview type style.
Perfect. Cool. So I think what's most beneficial for everyone that's watching this right now, first, let's acknowledge who's watching this. It's probably a couple different camps of chiropractors. One is been doing personal injury for a long time, saw the title of this, maybe knows who I am, knows who you are, maybe already works with you, works with me, saw the title list and said, okay, maybe I'll learn something else that'll help me out. So it's either someone who's been doing PI for a long time, or it's someone who's brand new to personal injury, or maybe a third camp, someone doesn't do PI at all, but is like, I didn't really want to, it's too much work, it's dirty, it's whatever. So there's like kind of 3 different camps in chiropractic as far as this. And I feel like that first camp, who does a lot of personal injury stuff, then there's a couple subdivisions of that person, right? That person could be someone who does a lot of personal injury because, like we talked about in these Facebook Lives, they're a captive clinic, meaning they have a couple of attorneys that send them people, they say jump, you say how high, and you're kind of like, man, I hope this relationship continues because it's what's fueling my entire practice. And if it goes away, I'm pretty much screwed because I'm relying on these couple of attorneys that are kind of working this like a marionette. And then you have the other type of doctor, which is what we're trying to do in our clinic, is branch out to lots of different attorneys, not try to build relationships because we're promising to cut bills and do something shady at the end of the month to give them some kind of kickback or something like that. But instead it's saying, look, this is high quality stuff. We're going to identify all the injuries. We're going to have stellar documentation. We can hold our own as far as if you need us to be there and available for a deposition or go to court. We're ready. We're ready to do this. We are patient advocates, but we also understand how the system works, and we are prepared to do this the best out of anyone that you've ever worked with. Okay, and so that last one right there, that is who who I and who our clinic is trying to aspire to be. I think we're moving in that direction. And I think all of those different categories that I just explained are going to get something out of what we're going to cover right now. So everyone in the audience, just please know that I sat down with Dr. Cronk and went through this, and kind of he and I almost like argued a little bit, kind of like going through prepping this, because I said, look, the first 80% of this, I think this is what people are going to want to hear. And Dr. Cronk's like, no, I've done a lot of these. I think they want to hear this. And so we kind of went back and forth, but the whole reason is because both of us have a slightly different position in this, in that I'm pretty new to this. Like I am new to this as of 6 months, meaning I've practiced for 17 years, but in the last 6 months, that's the first time I ever geared up and said, I'm going to go after personal injury. I have kind of avoided it a little bit because of certain negative connotations that I thought existed to really play ball in that field, or I just thought it was going to be way too much work to even get started, while still acknowledging all of us are open to being lifetime learners. There's always more stuff to learn to get better at it. So stating all that, throwing all that out there, I just want to say that just so you, doctor, who's watching this, knows that this is trying to be geared to help you no matter what situation you're in. And all I'm going to do is just share, here's what I learned as a student, basically learning from Dr. Cronk back in December. Our paths crossed. Excuse me. I jumped into his material, ran with it, built some videos, which we can talk about at the end a little bit, show those to attorneys, get their attention. The whole pot of the gold at the end of the rainbow is that you now have an attorney and you have their attention, and they're in your clinic, and you're giving them a tour, and you're talking to them, and you're having conversations. Well, in the last several weeks, I've had 13 of those face-to-face interactions and 22 on Zoom meetings, and I got 3 more already scheduled next week and 3 more the following week. So I'm doing this week after week after week. So I've gotten a lot of recent experience as far as knowing what these attorneys are asking, what they're looking for, and thinking carefully before I answer questions. Some of them I've answered better than others as I've gone through this. I've talked to Dr. Cronk throughout the process. He's helped me refine. But the cool thing is like literally you and I have gotten on calls. You've told me how to simplify a couple things, and then I use them the next day, and then I like, shoot you a message and say, hey, I just did this and it worked awesome. You're like, yeah, of course it did. Yeah. So that's what sparked doing this, is just saying, let's talk about the things that we've learned from this, or I've learned from this, that you kind of already know that. I mean, that's something that you already have as the wealth of knowledge, but now it's me as the student trying to extract it out and put it into this process. And so I think it'll be fun for us to go through this conversation and and then last thing I'll say, and then I'll shut up and I'll let you say something, is everyone who's on here live, ask questions. So type questions, ask questions, because I told my wife this morning I'm clearing my schedule for a little bit because we're doing a webinar that's going to go probably about an hour, and then we're going to answer questions. And so jump on, ask questions, let's run through them. But with that said, I'm going to pass it back over to you, and we'll take it from there.
Totally. So let's doctors, if you have questions at the end, we will stay for 15 minutes, a half hour, an hour, 3 hours, whatever you have in questions.
3 hours, let's do it.
All right, good. Yeah, your wife is Linda's gonna love that.
Right.
Okay, so what we said is, hey, look, we've been promoting, here are some of the problems that you got to solve that can blow attorney relationships. So one is you don't know what the injuries actually look like. If you don't know what they look like, you don't know how to document them. If you don't know what they look like, you don't know how to image them. If you don't know how to image them, your documentation is poor, right? If you don't know what they look like and you don't know how to image them, you already have massive complexity in your documentation. Your documentation is complex because it's trying to cover the fact that you haven't easily and accurately, sorry, let's get out of there. Try to put a mouse together. You haven't easily and accurately documented them, right? Through imaging. right? Now, if those first two complexities are there, guess what? You can't keep it simple. If you can't keep it simple, guess what? You're not good in depositions and you're not good in court. And if you don't understand these first three, you will constantly be getting crossed up with pre-existing conditions. Now, the biggest problem that you have right now in your market is nobody knows you. The hospital head administrator in your town does not know you. The top surgeons in your town do not know you. The top attorneys in your town do not know you, or city. When I say it's city or town. The top orthopedists in your area do not know you, right? So your sphere of influence, what you have to understand, doctor, is attention is currency. Attention is currency. Now I'm going to give you an example. Todd, we were just talking this morning. You started going out, you started reaching out to attorneys, and why don't you tell them what happened as far as the patients that you're picking up on doing kind of like a plaintiff IME?
Yeah, okay, great. So a common question from a handful of chiropractors who have been following this or who have been actually doing the same thing that we're doing that we're going to talk about towards the end, this attorney interactive video thing is a big piece of this. They ask, so are you seeing any new patients as a result? And I'll tell you that so far we're 7 weeks into doing this, and something that we have built a great relationship on one of these is this one firm, there's actually two firms now who have sent this over, is that in the conversation we have with them, okay, so in some of that conversation, we're touring them through the clinic and they're like, you know what, this is great, this is awesome, but doc, you know, just so you know, it's not that often that a client comes to us and has never seen a doctor at all. They've usually gone to a doctor, they have bills, and now they're starting to get pushback from the insurance company. And now they say it's time to get an attorney, and now they come see us. Okay. And so they say that to me, and I say, great. So here's the question for you. Has that patient gone through and had the appropriate examination to fully uncover all of their injuries? Meaning I just took you through this tour and we explained what we do, and you watch those videos, you understand a little bit more about spinal ligament injuries.
Just so you know, doctors, what he's talking about is he knows what these injuries looks like, and he knows that the attorney is working with doctors that don't. So he knows there's poor documentation. He knows how to keep it simple. And now that process is going to generate him referrals. Go ahead.
Yeah. So like something that just happened a couple of days ago was on Tuesday. I was going through a tour, and it was a husband and wife firm. So it was they do 100% PI. The husband's the attorney. She's like the paralegal, helps out with everything. They've been doing it for a long time, like 25 years. And so something that he said and she said, and they were talking about it, like questions they asked. They said, okay, so let's say you go through this. How do you know this wasn't there before? So what are they asking? Pre-existing conditions. And so simply, how did I respond to that? Yeah, easy, because I know. Because we go through, we do an exam, and we can show that this is something that is recent, is new, is linked up to what just happened in that crash. And also on the flip side, if it was something that was existing before, then there would have to be something coming forward showing that the person was actively treating for it. So if there wasn't, then this is a new injury. But the really simple part about this is that the injuries to the spine are basically come in 3 different flavors: fracture, disc herniation, excessive motion. And so right. I said it like that, and I kind of took her question, you know, answered it briefly, and then said fracture, disc herniation, excessive motion. That's something that you, Dr. Kronk, goes through all the time. And then so, you know, it's been drilled in. I explained it like that, and it stopped them in their tracks. And the attorney said, really? Is that it? And I said, yeah, that's it. Those are the 3 things that happen after some sort of trauma, after an injury. And he's like, oh, okay. And I said, typically the excessive motion one is not being checked or diagnosed, right? And so that immediately captured them further. It was like big smile on his face, and he's like, wow, this is simple, and this puts it in perspective. I like that. And then we continued our conversation, went on to the next topic. But the question you asked me was these IMEs that we're doing.
Right.
So
So how
now,
many, just to kind of cut to the chase,
yeah.
how many referrals have they sent you in like in the last week or two?
So in the last 2 weeks, we've had 5 IMEs come in.
Good. So 5 referrals. Now you weren't going for, prior to this, you weren't going for IMEs, were you?
No.
Good. So
No.
that IME opportunity unfolded as you got out in the market and you started to get attention.
Correct.
All
Yep.
right. And that 5 IMEs in your clinic, that generated probably anywhere from $40,000 to $50,000 worth of business for you, correct?
Yeah, I mean, that definitely has the potential to do that.
Good. So that's in 2 weeks. What was your total time with that attorney that generated that amount of service?
Yeah, so that one, and there was 2 who sent those in, probably cumulatively maybe 2-3 hours.
Good. So if, let's say 2 hours, I like 2 hours. Easier
Okay.
for me to do
Easier for
math.
There you
Yeah.
go.
Yeah. So 50K divided by 2 is 25,000 an hour. Now,
Yeah.
a lot of the doctors listening to this are going to go, oh, that's not real. I've went out to attorneys before. I struggle. I'm having difficulties with it. Attorneys don't understand what it is I do. They don't understand ligament injuries. They don't understand ligament, yada, yada, yada. Heard it all before. Okay, so here's what I want to tell you. Getting attention is not a one-time thing. It's not a one-time thing. The average American today, if you Google this, gets 6 to 10,000 marketing messages a day. Now, that average American includes the attorney, includes the medical doctors, includes the hospital administrator, includes everybody that you're trying to get attention from. So it's something that you have to be really, really, really consistent with. Now I'm gonna give you just a quick, what I set up is a slide deck this morning so that I could just go through a slide deck and pick out some things that I wanted to actually just go over and show. So this right here, very, very quickly, this is who I am. This is a slight capture of my background. Licensed 30 years, 17 years in the rooms, 175,000 times. How you doing today? Hey, how you doing today? How's your neck? How's the, are you doing your home traction? Are you doing your home care? Are you doing your spinal molding? How's your head weights going? Any pain with that? All right. 6,000, over 5,000, closer to 6,000 new patients. Doing exams, right? Developed 2 national spinal ligament testing companies, the second of which I helped to co-develop with a doctor named Steve Brownstein, who's a medical radiologist. Currently, I'm the CEO of that company. It's called Spinal Kinetics. Developer, co-developer of the system that we use, published researcher, developed ligament training for lawyers and doctors, completed a law degree in 2013, and we will be the first to bring AI to the market. Now, in order to do all that stuff, you have to do a lot. Those are 12, 14, 16-hour days for a lot of years. I don't golf. I don't do other things. This is what I do. That's not where I started. I started just like you. I started starving in this clinic. 2 years, first 2 years, I made 25K personally. 2 years, that's not a lot of money. Actually modified and did all those 5,000 patients that you saw that I just did. Those x-rays were drawn up with pencils and rulers, just like some of you used to do, 5,000 times. Right now, I never stopped with the understanding of ligament and ligament injury and how important it was. Today, some of you are Grant Cardone followers, right? So I'm just going to play this. The only reason why I'm going to play it is the information that we're talking about today is the information and why I got into a room. Little background. If you know Grant Cardone, that's great. I didn't know him until last October. I met him for the first time, and I met him for 5 minutes. I watched him for 2 hours at an event, and I met him for 5 minutes afterwards, right? 31 days later, I was introducing him. This is me right here. This is the royal family in the United Arab Emirates. This is the ex-Prime Minister of Thailand. The second in the UAE is right here, Grant Cardone, that's his wife. This is the Minister of Education right here. A business partner of mine is right here. The guy sitting right next to me is the Minister of Finance. Now, everyone in this room knows me as the ligament guy, right? So I have royal family members that are running the country coming to me and saying, look, we have to bring you back. I've had 2 back surgeries. We have a huge problem here with back and neck injuries. We're more interested in what you have to say, and we need to have you back. Now, yes, if you follow Grant Cardone, this is what happens. We're meeting here. Now, the only reason why I'm playing this is that this is what gets attention. Grant Cardone has 15 million followers that just saw this video. They've seen this video. They've seen what was happening with him in Dubai. They saw the video of us flying in a helicopter. The second person in the government of UAE is actually flying the helicopter. And I don't get that kind of attention because of, well, I'm a DC that practiced in Seattle, Washington for 17 years. I get that kind of attention because I can command it, one, because of my understanding of ligament conditions. So when I say, look, the biggest problem that you have right now is no one knows you. They don't know you, right? But the second problem is once they meet you, that's the first step. Hey, they got to meet you. Now, what's the impression of you after they've met you that they're going to walk away with? And that's where these questions come up. Hey, we don't, the majority of doctors in the market and the majority of attorneys in the market don't know what these injuries look like. Now, I don't have to, let's go to here. Good. So this is the ligament injury market. Doctors that are on the call today, a lot of you are going to be like I was, right? You think just because, hey, it's whiplash and I get adjusted and it's sprain strain that you know about ligament injuries. Furthest thing from the truth. Today, the ligament injury market is the blind leading the blind, which makes it the most opportunistic market in the injury market. The top people in the world say in published research and published books all over the place, it's been estimated that precise diagnosis is unknown in 80 to 90% of all low back disabilities in the work comp system. You look up this guy, he's the most published researcher in the world on intersegmental motion pressures, right? We can look at all the research we want to. 50% of the people who experience a whiplash injury never fully recover. 30% will remain moderately to severely disabled by their condition. Doctors, that is not bad patients, that's bad doctors. That is not bad patients, that's bad doctors. Now, medical doctors have their own struggles and their own challenges. We won't go into that today. And they're huge, right? What we're talking about too is chiropractors. Now, if we want to talk about chiropractors, chiropractic itself is less than 1% of the total healthcare market. So it's very small. So its impact sometimes is hard to have an impact, but even in that market, you have to actually have standardized methodology to your procedures that immediately interface in, and I'll show it in just a minute, I'll show it later, that immediately interface in with any other care provider, with the medical provider, any medical specialist, any surgeon, any neurosurgeon. You have to have your workups be able to immediately integrate. Remember I said attention is your biggest issue. We're getting yeah, go ahead.
I was going to say, while you're on that topic, could you just jump to and show how you teach to document taking a finding on x-ray of spinal instability and then going, is it is there motor, sensory, or pain issue, and correlating that? Because I think that right there is one of the simplest and like really nicest ways of putting this together. It takes all the stuff that we do as chiropractors that some of us just go, okay, I'm going through the motions of doing these, I'm doing these different tests, and this really points out, okay, like here's why this is so huge and so significant to document this thoroughly and connect the dots.
Right. Okay. So you said before, you can fracture it, you can herniate it, or you can cause excessive motion. Excessive motion is the worst condition. That's the most damaging and disabling condition. So we'll pull up a slide like this. Let me put it up so it's a little bit.
Three things: fracture, disc herniation, excessive motion. Fracture, disc herniation, excessive motion.
Yeah, and most people are not dealing with fractures. Most chiropractors in their clinic are not dealing with fractures, right? So you look at it and say cervical instability. An instability, a spinal instability is excessive motion that causes a motor, sensory, or a pain problem. Now, if I go to Medscape, just about every symptom that any chiropractor, the 95% of the symptoms that they're working on patients every single day is caused, according to Medscape, by a ligament injury, right? We have all the, like, there's so much research. We don't need any more research. There's that much research that validates what we do if you know how to simply look at it and use it, right? So what you're saying is, hey, when you have an injury, the first thing you got to be able to do is diagnose the injuries. So good. We have this patient comes in with neck pain, headaches, numbness in the arm, kind of three simple.
Oh, hey.
Yeah.
Hey, I just got a text from Matt. He says, hey, we can't see the PowerPoint, which I'm not sure. Hey, I guess real quick in the comment section, is there anything going on in the comments in the chat? We can see if anyone in here can't see the PowerPoint.
No, we're on air. Let me check it real quick. Only one.
Okay, so chat. Is there anyone in chat?
I can see it. I can see it. I can see it. I can see it. I can see it.
Everyone can see it. Okay, cool. Thanks. All right. So Matt, not sure what you're talking about.
Not sure.
Okay, cool.
Yeah,
I'm actually getting text messages from other people saying it's fine. It's showing up.
all right, good.
Okay.
All right.
Just wanted to make sure before we went through this and found out that no one could see anything.
No, yeah.
Okay. All right. Please continue. Sorry.
All right. So here, if we went, good. They've got these symptoms. Now, there's a number of things we got to do in this consult that takes about 2 minutes to do, 3 minutes to do. That will save you so much time. We're not going to go over the consult today. But first thing, probably most of you have some sort of a pain questionnaire and you have some sort of a pain thing of what are these people feeling? We got headaches. That immediately tells you upper cervical. Immediately. We got pain. That tells me all over the neck. We got numbness in the arms. That tells me mid-cervical generally. Right? So I can start thinking with levels. I do a motor or sensory check. Look, the motor sheet tells you exactly which ones to do. Those tell me levels, right? So to give you a better idea of that, those tell me levels. C5 nerve problem, good. C4, C5 motion unit. Now, I know that if I got ligament damage, it can be excessive motion, it can be disc herniation, or it can be a combination of the two. I need to know the integrity of these motion units, and those I need to image. So I image them, and I image them well. I send out. Now, a lot of you may have systems where you're not sending out. This training and the procedures, you have to make a professional decision on what you're doing. I'm going to tell you that you are, in some cases, and we'd have to talk, you are losing referrals because of it. Because the findings are so significant, and attorneys want medical providers in your care. They want it.
And that is something, and something that I'll second on that. That's something that comes up a lot in, and again, I'm speaking from recent experience of having 13 attorneys go through tours of the clinic, talking face to face for an hour, is this right here is when we talk about excessive motion, they're asking us, okay, so how are you measuring that so we can show that to the insurance company, or we can show this to the defense attorney? And we say, well, great. What we do in our clinic is we measure it first, okay? And it's just because we always have, because we do CBP and stuff. So we're already looking for these things. Doesn't mean that that's how everyone else practices, but how we do it, we measure it first. And if we see anything that is a grade 2 or grade 3, like if it's a certain amount, then I say, absolutely, I'm sending it out so I can get this documented. And then it's real simple. We have this little program on our computer. We pull it over. It sends over to you guys, over to Spinal Kinetics. And then within like 2 days, we get a report back. And then on the report, it clearly shows what they're finding, and then we take those findings and we put that into our note.
Good. So let me ask you a question, Todd. How many of your
Yeah.
patients have a grade 2 or grade 3 sprain finding?
It's probably about 2/3 of the, like at least 2/3 is what we're seeing.
Good. So you have a third of the patients that have no excessive motion at all.
I would say slight, or yeah, none probably.
Okay, good. Because that's about 29 times higher than what we tested. So that's an unusual norm, is all I'm saying on that particular thing. The majority of doctors, you're going to find that you have excessive motion on most, if not all, of your patients, because they're damaged. You can't damage the ligaments.
And that's also something too. I was actually going to ask you about that, and maybe you can just, if you could just touch on that briefly. So looking at measurements as far as if it's a grade 2 or grade 3, as far as how much translation or how much flexion extension is going on. When you're saying that, are you saying that excessive motion is, even if it doesn't qualify as a grade 2 or a grade 3, it's still something to note as excessive motion?
Well, excessive motion under 1 in translation or under 7 that's like a non-injury status. That's a normal status.
Yeah.
Right. So if you're going to injure the ligaments, you're going to go over 1. Or
Okay.
you're going to
So
go
as far as over 1 millimeter of translation,
over 7 degrees, the majority of patients that you have are going to be injured. So
yeah,
if you're under 7 and you're under 1, basically you're a grade 1 sprain, which is minimal. And what your study is showing at that point, from an excessive motion point of view, you haven't done an MRI, you haven't done, from an excessive motion point of view, you're showing a very mild condition.
Gotcha. So something I'll say is this, is that yes, it's way more common to see translation findings over 1 millimeter. Absolutely. You see that all the time. Angulation findings is a little bit less frequent as far as what we're finding. As far as in a more minor case, if you're comparing minor to major. And then in the major cases, we usually see both. There's usually increased angulation and increased excessive motion. Just yesterday, for example, when I was taking this attorney through the tour, and I'm in there with my associate doctor, Dr. Zach, he pulled up an x-ray of one of these patients that was an IME that had done chiropractic and PT and all this stuff, still had headaches, still had all this neck pain.
Mm-hmm.
And her x-rays were atrocious. She had a complete cervical kyphosis, and in flexion extension, she had a 4 millimeter translation. So she had 4 millimeters just in extension. And then in flexion, she had another like 1.5 forward. So it's moving around quite a bit. And it's something that hadn't been identified anywhere else. So that was a real major one. And that's a female in her early 30s.
Right. Okay. So the bottom line is, so let's make sure everyone knows where we are, right? So you do a motor, you do a sensory, you basically do a good x-rays, you basically do a excessive motion study. However you're going to do it, you do an excessive motion study. If you've got excessive motion in extension, you've got a severe, right here it says, hey, look, if I get an extension at C5 and C6, I got a 93% chance that I've got a disc problem there. I'm 100% specific if I don't have anything there. Okay, so we're talking 5 and 6 right here. If I don't have anything here in extension, it's 100% specific that I don't have a disc condition there. All right. If I have something here, it's 77% sensitive that I'm going to have a disc issue here. If I don't have anything there, it's 92% specific that I don't have a disc herniation there. These are the most common places to get disc herniations. This is all being told, by the way, on your flexion extension study in an examination and a correlation procedure that should take you no longer than 10 minutes. Now, obviously, you want to also know what the upper is, what the craniocervical junction findings are. So once you have the results back, remember, here's the results. Here's the result. Once you have the results back, it tells you, look, I got a severe. Well, here, I'll walk you through it. It says, hey, as far as grading of sprains, I got severe here, I got severe here, I got moderate here. As far as spinal instability, I've got severe here, I got moderate here, I got severe here. As far as grading for Croft treatment guidelines, I got grade 3 here, I got grade 4 here. Now I know I'm going fast for you doctors, but I also know that you already know this. But I know that you might be a little bit weak on it. You may not be able to go as quickly as I'm going right now because you haven't gone over it. You haven't, some of this stuff you may not have seen for a number of years, right? Now, I also know in the same 10-minute exam and clinical correlation that I've got sports modifications for activity that might kick in. What does that look like? That looks like this. Look, if you've got ratable levels of excessive motion, you've got a lower cervical contraindication for athletic activities. Now, don't get lost in that. Don't get lost in that. That's just something that you immediately know when somebody's trying to say, hey, this really isn't that significant. If it's not that significant, why is it in those guidelines? You also immediately know that you've got a surgical pre-authorization, pre-approval finding for a spinal fusion surgery. What does that mean? That means that if you go to spinal fusion guidelines or spinal disc replacement guidelines, it's going to say things like this. It's going to say things like down here at the bottom. I got to get, sorry, there we go. Flexion extension radiographs demonstrate instability, include any of the following. It's going to include these findings. So now my patient that I'm working on, I know has serious injury. I know that I have serious consensus as to what the findings mean. I've got the findings independent, right? So if you use a software system out there, one of the first questions that should be asked is, who did the study? I did. I'm the doctor. All right, you're the treating doctor, right? Yes, you're the treating doctor. Good. So you have a vested interest in having this patient appear to be highly damaged. Who validated your study? Did you have a radiologist ever look at it? No, why not? Right? Now, you may have good answers for those questions, but just putting yourself in position to get those questions answered, you're in a bad position.
Hey, real quick, chat, I'm getting some messages saying that chat's not active. They can't see chat. I don't know if it's just some people. Are you seeing chat on your end?
No one can see chat. No one can see chat on a GoToWebinar. Oh, chat?
Okay.
Oh, hold on.
Yeah, as far as if people are trying to ask questions, because on my end, I can't see anything.
Yeah, on the questions, I'm getting questions. We'll take questions as they come in, but it's not like that's what I was saying about the Zoom. You can actually see them. I'll go through all of the questions. So
Gotcha,
right
okay.
There's probably 15, 17 questions in here.
Okay, so just so you know, I can't see any of them on my end.
Yeah, you as a presenter, that's one of the problems with GoToWebinar.
Jeez, okay.
All right.
All right.
So,
I want to see the questions.
Yeah, all right, hold on.
Okay.
So, you know, these surgical guidelines, because what again, I want to go back through this because you got to understand just how simple. Boom, consult, know my symptoms, motor sensory checks. I know exactly what level. I go to that. I test for it. This is what shows up. I know that I also could have disc herniation on it. I know my grade of sprain. I know my grade of spinal instability. I know my Croft treatment guidelines that it kicks into. I know my surgical and impairment and also surgical guidelines that it also kicks into. Oh my God, doctors, you're actually treating on a regular basis things that qualify for spinal fusion surgeries, but you should be communicating that to the world, and you should be communicating it very simply. And you should be able to communicate it very simply when somebody says, this isn't a severe injury. This was low impact. This was on and on and on. The reason why low impact is so impacting is because the majority of professionals in the market don't know what these injuries look like in the first place. So they don't even know what to look for to yet, let alone document them. So you get this back, you do this workup, headaches, boom, there's my headaches. There's my neck pain. There's my arm numbness. Now, I also could do a MRI. Now I've got a disc herniation with severe excessive motion at the same time. I've got one of the worst connective tissue injuries to the spine that there is. This all leads me to set up my treatment plan. Whether I'm a chiropractor, I've set it up perfectly. If I do physical therapy in my clinic, I've set it up perfectly. If I refer out for physical therapy, I've set it out perfectly. If I'm connected to pain management specialists, I've set it up perfectly. What level, and when I do a posterior nerve burn or ablation, what level am I going to be looking at? When the provider goes in and says, hey, look, right here, I'm going to go in and do an injection. Boom. I'm going to do a nerve block. Oh my God, shut off the arm pain completely. Boom. Validates the whole process. Now, when you're working with a pain management specialist and you want, you want his referrals, or you want to work with him, and he's had 60 other chiropractors working with him, all saying the same kind of stuff, but they're not sending him in a complete workup that's actually getting him down to the levels, because guess what? He's got a bill, and where does his bill come in? Usually after you've exhausted the benefits, right? So when you set up your patient with, these are the types of injuries that I have, and you clinically correlate it, and you actually add the things that I just showed into your documentation, you're set up for pain management, for ablations, injections. You're set up if the patient needs a surgical consult. You're set up for everybody involved in the system. And what did we say? It may not seem simple right now, but it is so simple. It's simple, which means your documentation complexity goes away, which means you're no longer in the majority of doctors who understand or don't understand the ligaments or ligament injuries in the first place, or what the patient's injuries are in the first place. So you're outside of all of that, and you're going to be great in deposition. So let's just talk about great in deposition. I'm kind of an objective guy. So this is a doctor who I made this video, I would be willing to bet 5 years ago. I want you to listen to it. And the only thing, I don't care about the settlement amount. What I want you to care about is the fact that the doctor had an easy time of it.
Hey, Dr. Cron.
Hey, Dr. Smith, I got you on record, if that's all right with you. Is that all right with you?
Sure.
Okay. You called earlier. What was the call about?
My first case settled, and it settled for $370,000.
Congratulations. What?
Okay.
Now, that was the one that you were in court just Tuesday, right?
That's correct.
Okay, and that was your first one where you did testimony on ligament damage.
That's correct.
And you had a and if
I had a good time.
And you had a good time?
Court, yeah. I wasn't scared. I wasn't flustered. I didn't have any problems in court. the attorney for my patient kept me on the stand for 3.5 hours. I didn't know it was that late. I know that I was thirsty.
Yeah,
I didn't have any water. And
okay, so the time went by pretty quick. In other words, you were obviously.
yeah, well, I wasn't just sitting there. I had the pictures of the model, you know, the one that I think you've shown it before that's got all the ligaments on it, the 10 ligaments you always talk about.
Absolutely.
I explained that. I also had a model, and I showed how the spine sheared in the accident.
Yeah.
And then I used the
So you actually showed the mechanism of injury and the lesion that's left behind.
that's correct.
Good. So it's just simplicity. So what we just talked about here is he knew the injuries, he knew what they look like, he documented them well. He didn't add in document complexity. He knew how to keep it simple because he used simple analogies. He got those simple analogies through a training that I have. And so he did a great job in court. Doctors, you shouldn't care about court settlement numbers. You should care less. What you should care about is how easy it is for you to do these procedures when called upon to do them. That's the only thing that you should be interested in. Todd, when I look at it and I see doctors that are getting deposed all the time, and you can go through that if you're starting to get a bigger clinic, you can go through that, but it'll shut off the easier and the more precise and the simpler you are in your explanations. It'll start to shut off because no one wants to take you to court because you're effective.
Mm-hmm. Yeah, and something else too that I'll just mention is that in these conversations when I'm talking with the attorney, something else that's really powerful is I tell them about the training that we go through in your program. So I tell them, I say, and we work with this guy named Dr. Jeff Kronk, who is a chiropractor, went to law school. He's out in Florida, and he has 2 programs. He has one called Smart Injury Doctors. He trains chiropractors on this stuff, but he also trains attorneys. He has one called Smart Injury Lawyers. And so he's a wealth of knowledge helping us with this. He also even has deposition training as well. And this is something I've been telling these attorneys, and they look at it, they look at me and they say, wow, that's awesome. That's great. You know, and so them knowing that we have access and we're going through this specialized type of training also gives them a lot more confidence as far as in working with us.
Yeah, absolutely. I mean, it's just, you know, doctors, one of the things we talked about was, hey, the only one I really haven't touched on here is pre-existing conditions. So let me just touch real quick on pre-existing conditions. Then I want to show you a video or two, and then I'm going to turn it over to Todd, and we're going to explain to you what's been developed. But I want to give you enough of a full enough feeling. So I have a law degree, and in my law thesis that I did it on pre-existing conditions, right? The law of pre-existing conditions, right? It's a settled principle. So this is Maurer versus the United States. This is federal law, by the way. This is not state law. This is federal law. It is a settled principle of tort law that when a defendant's wrongful act causes injury, he is fully liable for the resulting damage, even though the injured plaintiff had a pre-existing condition that made the consequences of the wrongful act more severe. Now, is this degenerative change at C5 and C6, is that a pre-existing condition? Yes. Yes, it is. What does this say? This says that who cares if you had that? It's not actually part of the equation. But you're going to say, well, gosh, my attorneys don't know that. Why don't the attorneys know that? All right, that's true. All right, now let me look at something once here. This is an excessive motion report example. This degeneration is at 5 and is at 2, 3, 4. It's at 5 and 6. This patient has a ratable level of angular finding. Now, what that means is at C3, go back up. At C3, let me go down. At C3, good.
Going once, going twice.
At C3,
sold.
What it means is at C3, if they wanted to get a pre-authorization for a spinal fusion surgery, they qualify. They also have a ratable impairment. So it means they have a severe injury They have a severe injury here, here. Is there any pre-existing condition here? No, the pre-existing condition is here. If I have a leg injury and I have a pre-existing ankle condition, but I have a knee injury, is anybody going to talk about my pre-existing ankle injury to try to explain why I have pain in my knee? No. And anybody that does is going to look like an absolute fool.
This is, and just to clarify, this is when there's a trauma involved.
Yeah, this is when there's a trauma involved.
Yeah.
So good. So I'm on a bike, right? I get hit by a car. They damage my knee.
Right.
I have had problems because I was injured a number of times in the past, and I've had injuries to my ankle, and I've had 2 surgeries to my ankle, and my ankle's really unstable. It's got degenerative change in it due to all my injuries that I've had in my ankle. Now I got a new leg injury. Remember, the ankle is part of the leg. Remember, C5 and C6 are part of the neck. So is C2 and C3, but they're completely separate parts. Good. So if I have that knee injury, nobody's going to bring up my pre-existing condition in my ankle as the cause of my knee problem. Now, most doctors compress this whole thing as one unit. So they make this whole huge amount of real estate one unit. And that's why they suffer with pre-existing conditions. If you have an auto accident and you have this, you would know that you're more likely to have severe ligament damage above or below this level than you would at this level. And these levels have no pre-existing condition. So when somebody says, if somebody took this case and said, well, doc, what about the pre-existing condition? I'd say, yeah, what about the pre-existing heart condition? How about the pre-existing diabetes? How about the pre-existing obesity? Which pre-existing condition are you talking? Well, we're talking about this right here. Yeah, where is that? It's right here. We're talking about an injury that's right here. If this were here and this were fractured, would anybody be talking about this? No. The only reason why they talk about this is because the doctors in the market do not know how to differentiate the injuries.
And neither do the attorneys.
And neither do the attorneys. So you can be, let me give you an example of what you can be when you're starting to teach this. So Todd goes out, he starts teaching attorneys, and all of a sudden he goes, hey, the attorney is now going, hey, I'm going to send you my IME. These other doctors mess these cases up. We're going to start sending you in. Here's our first 5, right? So this is an attorney's. If you look at this attorney, he's done over 6,000 cases. He's tried over 500 cases into jury trial. His numbers are off the charts on what he does and what he gets. Now, listen to what he says here. And I want you to understand that he started probably 7 years ago, 6 years ago, and he is now teaching doctors what they should already know. Listen.
Amazing, because you do try a lot of cases. So I guess what I'd like to do is just kind of start off and say, you know, one, how did you get into this idea of ligament testing and this whole idea of how has that helped you in sort of your progression as a personal injury attorney?
Well, I learned about motion segment integrity and CRMA from somebody by the name of Dr. Jeff Kronk. And we were trying to figure out how long ago it was, Doctor, that I sat in the audience with 90 chiropractors and maybe 2 or 3 other attorneys and listened to you talking about motion segment integrity, ligamentous damage. I don't play golf. I don't have a boat. I enjoy my family and medical research. So I started researching this thing and discovered that the AMA, American Medical Association, has been recognizing alteration of motion segment integrity as a basis of physical impairment and even a rating pyramid, and I took it from there. Last December 16, I gave a 3-hour presentation to about 90 chiropractors to comply with the Minnesota continuing chiropractic education requirements. 3 hours on x-ray and radiography by a lawyer. Hello, by a lawyer.
Right.
And I had people come up to me afterwards and say, how does a lawyer know more than we do? And I said, I guess I don't play golf and I don't have a boat.
Right, but it's kind of interesting, Doug, isn't it? Because realistically, it shouldn't be that way. Realistically.
Well, and what opened, Doctor, let me explain what opened my eyes to the situation was after listening to you, I had Gina's case. Can I tell about Gina's case?
Sure. I don't know if you want to give like last name.
No.
Yeah.
And it's not even Gina. I call it Gina's case.
All right,
Gina was a 15-year-old that was in a car accident, and her chiropractor did an MRI 2 to 3 months post-accident that showed up perfectly normal. 2 years later, Gina is still having significant cervical pain. And I used that as my first test case. We had x-rays done. In that particular case, they were done by motion x-rays, but digital motion x-rays. And your Spinal kinetics did the assessment, the computerized assessment and valuation, and turned out that she had significant and rateable objective findings of significant motion segment integrity, both, in her case, both angular and translational.
No.
And I decided to go back and have her have an MRI done a little more than 2 years later. And all of a sudden, this 15-year-old spine that had been imaged by MRI right after the accident as totally normal shows the degeneration of a 45 to 50-year-old lady, accelerated degeneration. And that's when I came up with the term traumatically induced degeneration syndrome, and have been lecturing about ligamentous injury being the basis of many, if not most, cervical and lumbar injuries.
Good, doctor.
Amazing, because you do try a lot.
Good, doctor. So the only reason why I wanted to play that is first, like I got his attention probably 6 years ago, right? Now he's teaching. He is a lawyer, is teaching x-ray to doctors and having doctors come up and say, wow, how do you know more about x-ray than I do? That's an unfortunate situation. Now, it doesn't have to be an unfortunate situation for you, right? Doug Schmidt talks about me in just about every lecture he gives. Now, is that marketing? 100%, 100%. Does he know me? 100%. Have I gotten his attention? 100%. That's what you do if you want to grow a large and a really stable injury practice. You got to get attention. You got to get attention. And so, you know, what I want to do now, Todd, I think is, look, we'll do question and answer. I can come back to this slide deck. There's so many things that I can. Are there some? Yeah, go ahead.
I'm just thinking right now, before we switch it over, are there some questions right now that have popped up that maybe we can run through and address?
Sure. Good. So let's go through. I was solicited to take PA case on a lien 3 years ago, haven't been paid, no one returning my calls. What are my options to get paid? It's constant communication. You have to be in communication with that personal injury firm. If I wanted to get to know them better, I would actually show up. but everybody wants to do everything at a distance. They want to do things on a text. They want to do things on an email, because they're, a lot of times in my experience, Jeannie, they're afraid to go communicate with the attorney, right? What's the matter with going and communicating, finding out what's going on with the attorney? Maybe the attorney's having a bad problem. Maybe they got into an accident themselves. Maybe they've been off work. Maybe they just went through a divorce. Maybe they just lost a child. Maybe. But what your mind will go to a lot of times is it'll go to, they're screwing me over, or they don't like my work, or some negative toward you yourself. But until you get in communication with them, you don't know. That's just a personal tip, professional to professional. Get in communication with them. What should I charge for a depot or court? These are the kind of questions that a lot of times come up. I'm not going to talk about that in a program like this, what you should charge or what you should bill or anything else. I simply can't. We can go over that in other different forums, but not in a forum like this. What's an IME? It's called an independent medical examination. How can you show there wasn't ligament damage prior to the auto accident? Because that's easy once you understand the terminology of pre-existing conditions, which we didn't go over today, but that's certainly, once you understand the terms, it's really, really easy. How much do you charge for an IME? Again, we're not going to go over charges or how much do we charge. Is there supposed to be a PowerPoint we can see? Yeah, everyone can see the PowerPoint. Some can't. It's usually because you've opened up.
On mobile, I think.
Either on mobile, but a lot of times what's happened is you've got a screen that's open, but you have a screen right behind it that has the PowerPoint. 50% never recover, 30% moderately disabled. What was the last thing? That was the last thing on that particular slide. Other statistics are significantly higher. So I'm putting you a moderate statistic when it says 50% never recover. In my program, I have 41 stats in a nice stat file that shows you all of the horrific stats that are out there. What's the best treatment for ligament laxity? Good, your treatment. And I know that's not going to make sense to you, but you've been treating them. You should understand how your treatment and how to modify your treatment to get better results with your ligament laxity.
If I can throw in some 2 cents on that as far as the best treatment for ligament laxity. So it's kind of going back to what Dr. Cronk was just showing, like, if at C5, C6, there's extreme DJD, that's the area that's going to be fixated. It's probably not going to be moving all that much on flexion extension x-ray. The stuff above and below is excessive. Typically though, as we know as chiropractors, junction points in the spine are usually fixated, cervical thoracic junction, so usually lower cervical, C7, T1. So it's like making sure you're finding hypomobile segments and making them move properly. Also curve is going to affect overall function of that area. So the way that I would explain that to an attorney, and I have explained many times, is that someone comes in and they have a cervical kyphosis and they have a ligament injury in the middle. Putting a curve back into the neck makes that structure much stronger and more resilient. So even if that ligament itself is still damaged and there's still excessive motion there, having an abnormal cervical curve is way more fuel for the fire. If you can start to restore more of a cervical curve in there, then that is going to help that person significantly. And then looking at functional rehab, functional movement, making sure that movement patterns are working properly, so that from a motor control standpoint, how their brain gets their body to move. And that's a whole thing that we actually do, is we actually teach this stuff in Move Now as far as functional rehab, functional movement. So it's on one end, and this is a thing that is a great analogy I heard from Dr. Cronk. He said, okay, if you go in and injure your knee and you blow out your medial collateral ligament, you can go through rehab, you can do exercise, you can do all the stuff, and you can get to the point where you might even be asymptomatic and pretty functional. But once you had a ligament damage to your knee, it's permanently altered, right? It's something that is there, and it's a weakened area. And so that relates into like cervical spine. Someone says, well, is this ligament injury permanent? Okay. And the whole response to that is that ligament is permanently damaged. There's things we can do to help create stability by other means and help out, but that ligament is permanently damaged because of what we found here. Is that
Right. Right. So to answer, I'm going to take a different shot since
Okay.
you forced me into it.
Yeah, forced you.
What's the best treatment for ligament injury? Spinal adjusting and rehabilitation. Now, you got to remember, you just got an explanation, right? All right. Now, you got two explanations to compare to,
Mhm.
right? You just got yours, Todd, of what you were talking about. You're talking about hyper instability and instability.
And that is more of a explanation from doctor to doctor, but as far as what you're going to say is the explanation of what you say to the attorney, correct?
Well, even what I say to the doctor, even what I
Mhm.
say to the doctors at first in something like this, because one of the things you're going to learn to do, doctors, is you're going to learn that when you're presenting, I don't care who you're presenting it to. If you're presenting something, you want to present the simplicity first and then the complexity behind it second, right? You want to actually go very, very right to the point of Dr. Pickman is the top research. As far as I'm concerned, he's the top functional rehabilitation specialist in the country. Okay, he can go into functional rehab that will make my head spin, right? And he knows it really well, so I'll be able to track with him, right? But this right here, the question gets into maybe what the real question is that Dr. Hernandez has is, can you adjust the spinal instability? Absolutely you can, right? So do you have to worry about, are you right here, if we look x-ray wise, if this is the x-ray study, where is our hypermobility? Radiologically, it's not there, right? Radiologically, if we can only adjust a hypomobility, radiologically, we have nothing to adjust here, except for maybe 6 on 7. Remember what 1 and 2 was in this study. So we have to understand that there's on what we're seeing. So if I have an ankle injury, and this maybe we'll just spend a little bit of time. If I have an ankle injury, when I have that ankle injury, it's swollen, right? So it's going to feel like hypo. If I'm palpating it, if I'm trying to move it, it's going to feel like hypo. But the ligaments underneath it are damaged badly, right? As the pain and inflammation goes away, yes, you will feel the instability then. Now, X-ray wise, though, I will see it even if it's severely sprained. One of the radiologists that basically worked for Spinal Kinetics for a number of years was one of the top people in the country on X-raying ankles when they're injured. And guess how they did it? They actually put in gloves and they shifted the ankle with their hands while they were X-raying to show how badly damaged the ligaments were. Now, is that person, I was like, wow, do you have to inject them to get to do that? Or, I mean, are they scream when that happens? And he was like, yeah, it just depends on when you're doing it and you got to know what you're doing. But that instability is there. How it feels palpation wise or other testing is going to feel like a hypo. So, that's one of the things out there. And again, I don't want to get too deep into minutia.
And from a quick standpoint, touching on not getting too deep into the minutia, I'll throw a last piece of minutia is like, there's the paper that you referred to that Dan Murphy talks about, right? As far as stimulating joint mechanoreceptors, creating stability by stimulating joint mechanoreceptors with chiropractic adjustment.
Exactly. Totally. All right, let me just run through a couple. What is the grade range of a sprain? Kurt, that's a great question, and you actually have it right there, what you said. So what we're going to get is, usually when I do these types of programs, we're going to get a lot of clinical questions. Now, the reason why we're getting so many clinical questions is because there's so many clinical questions that are unanswered for the provider. Now, let's just use this as an example. Right now, there's another, let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. There's 21 different clinical questions here. We have doctors from all over the country logged into this program. There is 21 different, so there's probably, I don't know however many we've answered. So let's say there's 30 or 40 clinical questions. And what I want to say to that is, let's go back up here to this slide. If there's 21 different complicated questions that people are trying to sort through, can they keep it simple? No, because they're still trying to understand it. You can't keep something simple that you're still trying to understand. When you fully understand it, it's really simple. And what a lot of you will do, and I know this because I used to do it too, well, can't be that simple. I used to be that way. I used to be the most complicated son of a gun in the room. I used to spend so much time in my head thinking. And when I was spending so much time in my head thinking, I wasn't doing anything else. Was I busy? No. Was I productive? No. Was I prosperous? No. Why? Because I was thinking. I was trying to spend all this time thinking before I do. Todd Pickman, I hook up with him. He's a doer. I mean, he's the first one that I ever went. I showed up. I think I had a T-shirt on. He's like, "Well, shoot the video today." You know, I used to prep for a video. You know, I got to get my makeup. I got to, I got to get my bald spot. The
shine,
so it doesn't shine. Oh no, we're doing it right now. So there's so many questions here today, and they're great questions, doctors. They're questions that I had too. Every single question. Yeah.
If I can just jump into, and granted, I know this audience, there's some that are part of Smart Injury Doctors, they've access to your program, some are not. I'll tell you this, all those questions you're asking are the same things that I wanted to know too. So like as doctors, I know that we want to know the answers to that. It's not always a very quick, simple explanation, but inside Smart Injury Doctors, and maybe that's something that you should pull up real quick, is just logging into Smart Injury Doctors and just kind of briefly showing how it's covered, because it's all in there and it goes through. Some of the videos are 5 minutes, some are 15 minutes, and Dr. Cronk does a great job doing it, because as he'll go through it, he'll have the different research studies pulled up, he'll show those, he'll show the different laws, and it goes through in sequence. The whole first chunk of the program is just understanding spinal ligament injuries, and it touches on all that stuff as far as pre-existing conditions, as far as how to document it, key things that you put in the notes. And then, yeah, so like that first one right there, the Smart Injury Doctor Training Program.
Right here, Smart Injury Doctors Training Program. Good.
Yeah.
So you're gonna log in, you're gonna go to welcome, you're gonna actually go, okay, good. It's gonna tell you what to do, how to get in the Facebook user group. It's gonna tell you to go to this course. It's gonna give you some background information, couple key terms that you need to understand, real quick stuff. And it's gonna give you the most basic thing that you have to understand in order to make documentation. All 5 things that you basically need to be able to do is in 2 videos. The foundation of it all is in one 11-minute video, and in the second 14-minute video.
Hey, and then this real quick too, guys, this is something else to look at. These are things that we printed out, but this is all Cronk stuff. Okay, so these are these PDFs that are really freaking nice. Okay, and so we printed these out because at first our plan was to, hand deliver these to all these attorneys. So one is called the 5 most common ways soft tissue injury doctors kill your clients' insurance benefits. Instead of handing this out, guess what we did? We made an animation video explaining all of these things. That's part of what we have the attorneys watch. All right. This one, the 7 essentials to getting great recovery results and excellent legal help for any spinal ligament injury. We took pieces out of this. We put that into a video. That's the second video in the attorney interactive videos, which is all about spinal ligament injuries. 3 biggest pitfalls of MRI and spinal, and then there's pieces of this that we touch on in the video too. So I'm just showing you this because this whole thing is also inside Smart Injury Doctors, where, let's see, I don't know how many PDFs you made. I saw some email you just sent out to all the members saying that there's another one that you just made on CRMA testing, right?
Yeah. Yeah. So
that one is out now. Is that out now?
Yeah. So here I got
that one.
Yeah. Let's see. I got a slide in here somewhere. At least I thought I did. Maybe I don't. Let me see. No, I thought I threw it in a slide of the PDFs. I guess I don't have it. So, going back, look, doctors, these are short videos that you watch that go over and clarify things that all these questions that you may have, they get clarified in here. Now, maybe not all of them, but that's what you have a Facebook user group to get help with.
Mhm.
And
we're at about, right now it's 11:15 Mountain, so we've been at this for about an hour and 15 minutes, which we're probably starting to push everyone's attention span. So main thing I think is a summary, guys, is that the way that I look at the smart injury doctor stuff is I don't care if you've been doing PI forever and you know everything under the sun with PI. The cool thing that Kronk does is he helps like clean up the language, simple, like how to communicate it. It's really how do you communicate this process? That's the part that I think would be most beneficial for you if you're already super well versed in this stuff. And then all the marketing stuff inside. There's a whole marketing section, PDFs, Facebook posts, stuff you can attach in emails when you send them over to attorney. I mean, there's so much freaking stuff in here. It's crazy. Deposition training, which I went through that several weeks ago. It's about 4 hours of training. We took like 60 pages of notes on it. That's awesome. So, excuse me. That's what Smart Injury Doctors is that whether you're seasoned or you're new, it'll get you going, and it's there as like a big reference that you can always go back to. Okay. Let's switch gears real quick.
Yeah,
I'm going to show you. I'm sorry.
Yeah, let's do it. I'm gonna switch you over as the presenter.
Cool. So what I'll do is share my screen, try to sum this up so that just so you know, like all the stuff we're talking about right now, whether you as the doctor on here now are already part of the attorney interactive videos, great. Let's just refresh your memory as far as how to use this and some of the resources that are available for you. And let's see, this one, okay. And let's see, show my screen. Okay, good. You can see my screen now? Okay, so whether you're already part of this, good. Hopefully there's some stuff we covered that got you excited about it, and you can start using this if you haven't started using it yet. This is the thing that we've built for a handful of doctors around the country, and part of the takeaway from this is that if you're not a member of Smart Injury Doctors, something that we did is just made like a little joined up thing where you can join Smart Injury Doctors for a discounted rate, and you can get us to build the attorney interactive videos for you, customize it for your clinic. Let me show you what this is, and then we can at least leave you with a link on here on the live. So if you want to jump on and look at it, you can see more detail and poke around. This right here, this is Dr. Singyup Rao. He's actually a member of Move Now University. I introduced him to Smart Injury Doctors. He joined it, loves it. Okay. Then when I did this attorney interactive video thing about, I don't know, maybe 2 months ago or however long ago I built this, he was the first one to jump on. So I said, okay, Ro, here's the deal. You're the first one. So I'm going to show yours off to everyone. He's like, okay, I don't care. So Ro, what we did, this video right here, this is the link that he is sending out to attorneys. He calls them, has a conversation with them. If he can't get a hold of them, he sends an email. Hey, John, this is Dr. Rowe at Rowe Sports Chiropractic. I tried calling, I wasn't able to get a hold of you. Check this thing out right here, blah, 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 whatever. There's scripts that we put together as far as how to grab the attention of the attorneys, whether it's talking to them on the phone, email, or LinkedIn Messenger. Those are the 3 ways that we're reaching out to attorneys. But then you send them this link for them to watch this. And so I'll just show you a quick little intro of this. It's going to play. Let me ask you a question. What if you found out that you may have left tens of thousands of dollars on the table for improperly documented injuries on personal injury cases that you've settled? This free video series was designed on behalf of Dr. Singyup Rao at Rowe Sports Chiropractic, and it's important that you are investing the time to watch what we have put together. We are confident that you will see the dramatic difference this will make in every case that you settle. Not only will this help you better serve your clients, but this will drastically change the way that you look at injuries and what you look for in the doctors you trust for your clients' care. The truth is, most doctors and many attorneys are only seeing the tip of the iceberg when it comes to treating and representing these personal injury cases because they do not know how to dive below the surface. Dr. Rowe has devoted his... So essentially it starts off, there's a hook, so it catches their attention. What if you found out you're leaving tens of thousands of dollars on the table? Wait, what? And then they watch it and it pulls them in, and then In this first video, it talks about here's what we're not looking for in attorney relationships. So it starts off kind of like not what we are looking for, what we're not looking for. And it spells out, because it's just as important to capture who you want to work with and repel the people you don't want to work with. The majority of the attorneys we send this to are attracted to this. They want to be the type of attorney that we're describing in this video. Now, in the link that we'll give you, don't worry, you can go through and watch all these videos on your own time. So I'm not just going to sit here and play these videos on with you live, especially because I know we have probably a handful of members who already have these videos we built for you. So you're already familiar with the videos. But then on the outro of the video, it talks about what we're going to talk about on the next video, and then it has your clinic logo, your information on this.
Next video, I will show you the hidden spinal ligament injuries that MRI was never designed to uncover, that are the true value of your client's future health.
Okay, and then it goes to the little outro logo, and then they click the button, take me to the next section. The next section goes to the next video. That's why it's called attorney interactive videos. The psychology of this, of not just sending a 20-minute video for someone to watch from start to finish, is they fall off at 10 minutes, right? They lose interest. There's only so much attention span that you can capture. When you split it up into these bite-sized pieces that all have a theme, and each one has a attention-getting intro, an outro that hooks them to want to watch the next one, it's like watching a good movie. You're like, I can't wait to see what happens next. Now we're cutting to the commercial. Oh man, okay, what's next? Okay, and they click the next one. And it's working because all these attorneys that we're sending this off to are watching it. I have emails that they send to Kate, who does all of our marketing stuff for our clinic, and she forwards it to me. And it's these attorneys giving this feedback like, hey, I really loved when you talked about this thing on spinal ligament injuries. I didn't know that. That's fascinating. Tell me more. Well done. I really like it. Hey, this is exactly what I wish more doctors were doing that we're working with. That's the kind of feedback we get. Every once in a while, you get someone that says, don't email me again. That's like the 1 out of the 100 that we send out to. So most people really, really value this and like this. So this one, I'll play just a little bit.
Now I will reveal to you these hidden spinal ligament injuries that are routinely missed across the board. So doctors and attorneys alike are falsely led to believe that MRI is the highest level of diagnostic superiority in the imaging food chain. This is simply not true. So first off, what happens when your client is involved in a trauma and injury? Did they see it coming? We know it makes a difference whether they were braced for the impact. Was their head turned one way or the other at the time of the crash? These risk factors definitely do matter, but what matters most is not the mechanism of injury, also known as the force delivery system, but rather the injury or the derangement pattern that is left behind. So what does that mean? Every injury leaves a biomarker, evidence that is consistent with the type of injury involved. So an injury such as hot grease splashing on the skin will leave a burn. A gunshot will leave a bullet wound. A dog bite will leave bite marks. And a motor vehicle crash will oftentimes leave a measurable injury, identified as an imaging biomarker that many in the healthcare profession are blatantly missing. This costs the patient a missed diagnosis and tens of thousands of dollars that they're rightfully entitled to. Let's dive into some anatomy.
Cool. So what is it doing? It's using terminology so that the attorney goes, this guy knows what he's talking about. He's talking about force delivery system. He's talking about mechanism of injury stuff, talking about a derangement pattern that's left behind. So it's like, it's getting them to tune in to say, okay, this is not the average doctor, right? And then you educate them on how we look for spinal ligament injuries. So I go into that here, excessive motion, and it all ties back into the stuff that Dr. Kronk put in those PDFs. And all we did was take those, write scripts, put them together, ran them by Dr. Kronk. He helped fine tune them a little bit. And then I spent, 40 plus hours making all this stuff, which took me a couple years to learn how to do this, which is why it only took me 40 hours to make it, made it for our clinic. And then it was actually, I can't remember whose idea it was, if it was me or Dr. Kronk. He said, like, is there a way you can now make this for other doctors so they can use it in their community? And so then I had to take the whole thing, change the script slightly so it was universal, so it wasn't talking about me and my clinic, but it would work for your clinic. And then we figured out what pieces needed to be cut and customized. And then me and my team decided to start building a system to do that so we could do it efficiently. And now we've done this for a bunch of doctors. And then this is like the final product. Notice how that button just popped out, it says move to part 2. It's timed, so it keeps them on the page until the majority of the video is played. It shows a preview of what's coming. They click on the button, it goes to the next video. Again, I'm not going to go through all of this, but look, 5 critical mistakes. That's That's this one right here. The 5 most common right here, okay, that kill the benefits.
But Todd, you're going to do a follow-up. You're going to give them that when you do a follow-up, right?
Yeah, exactly. So typically what we'll do in an email version, we'll attach that as one of the PDFs because it gives us an excuse to follow up with them and say, hey, it was great meeting with you or whatever. Like having all those things to attach and send in emails gives you an excuse to message them electronically. We also send them a card in the mail, also important because they're way more likely to open something in the mail that's handwritten to them. And there's a whole host of things that we've done with this, but now that program, we built a training on how we do it and how we use it. And this is my marketer. You see her right here in the tiny little picture. Her name's Kate. And her and I go through, and we go through this process of you make a list of attorneys, you put them in group D, which is any old attorney that might do PI, that lists that they do PI, that is 100% PI. That's group D, okay? Find 100 or 500, depending on what city you're in. And then you have a process of going through call, email, LinkedIn, right? You then address these, you get their attention, then you introduce right here, might be tough to see, but you introduce the attorney interactive video. You then send them the link, right? Then you follow up to make sure they watched it. Once they confirmed it, you then schedule them to get on a Zoom meeting with you as the doctor. So whether you're doing this yourself or you have your staff doing it, then you schedule a Zoom link call. You get on Zoom, you have a conversation, develop some trust and rapport. Why are we doing Zoom? Because we built this thing when the coronavirus thing first hit, so we couldn't meet with anyone in person. But then we realized that this is timeless and this is something that is going to work all the time because it's so much easier for you and an attorney to meet up on a Zoom meeting instead of having to like clear your schedule and do all of this stuff to meet up in person. Start off here, meet on a Zoom meeting. And then the goal is to then, show them some of the documentation stuff you do, highlight some of the things you do, have a conversation, and then get them to come into your clinic for a tour. And then you cater some food into the clinic, or you go and eat lunch across the street from the clinic if you got a good place to eat, and you sit down and you build a relationship. And then once you do that, you've moved them from group D to group A. Once they're in group A, you nurture them indefinitely. And we have steps of how we nurture them every 2 weeks indefinitely, right? So this is what we've done. And so far in the last 7 weeks, I believe it's 7 weeks, group B, people who've watched the videos and I've done a Zoom meeting with them. I have 22 attorneys I've done this with. We have 13 that have come in person, and we're still continuously getting people to go from group D to group C. They're trickling in from group D to C, meaning they are starting to watch the videos. They're saying, oh, sorry, like last time when you reached out to me, I was super busy. I had this family emergency. I had whatever. Now I'm ready to check out that thing. Can you send the link again, right? And the goal then is to build up a group A and have these high quality relationships. And our goal here for our city is to get about 30 to 40, I would say. So 30 to 40 attorneys in this group right here, then I'll be satisfied. And then we're going to nurture that list. And then we're branching out, and we also built a version of this for medical doctors. So our next step is to then get into medical clinics and do this. That's called the physician interactive videos. I wrote different scripts, made it targeted to medical doctors, and those are both 2 programs that we can build for you. We charge a certain amount for the attorney one, it's a little more, and then it's much less for the physician one, because if we build them both at the same time, it takes us less time, so we pass that on to you and hook you up pricing wise. Now, let me just show you this. In the training, every script for everything is in here. So how do you move them from group D to group C? We got the script. We got here phone call, email, LinkedIn. You click on it, it's a Word document. That's what you turn over to your team. It's all very step by step. And then all you do in here is you go in, you basically upload your clinic logo and a professional picture of you. You hit this and you send it to us, and we start building it for you. It takes us a couple days to build it typically. Now, we also have a Facebook group that's called Functional Movement for Chiropractors. Everyone that joins this, we tell you join Functional Movement for Chiropractors, ask questions specifically about the attorney interactive videos. Keep in mind, you'll also have access to Smart Injury Doctors Facebook group. So you have specific questions you can ask for Dr. Kronk, and I'm in that group too. So if you're part of the attorney interactive video and you got a question for both, tag both of us, we'll jump in, answer questions. If it's a question that requires more detail, we'll jump on and do a Facebook Live and just go off on that topic. This is me and Kate yesterday. So Kate is my marketing liaison. Her and I did a 49-minute training, and we had 19 comments, and we had like 30 people on it live, which was awesome.
I've never seen before.
So look,
I really love this concept. Looks like you have everything covered.
So-
Every liaison's gonna have their own like way of doing things.
So people are asking questions. How do you get past the front desk? How do you do this? How do you do this? And so Kate's going through and sharing her experiences with this. So Kate is so awesome. She's connected with multiple doctors and their team who are part of the Attorney Interactive videos, and she'll jump on a phone call with them. She'll use the Marco Polo app, where like they can video her back and forth, and she can kind of coach them, and she can show them how she's doing it. And something that her and I are going to start doing is these Facebook Lives. We're going to probably do them every week, Fridays likely. And so if there's a desire and a demand, I want anyone who's getting this to be able to do it successfully and be able to share the success of, hey, I got all these meetings with attorneys. Here's how it worked. Now, that's the main thing I want to say about this, because I know we're getting to the end of it. Something I'm going to do as a bonus though, okay? And I thought of this as I was doing this. This is a bonus. I haven't even told Dr. Cronk about this. For anyone that joins on this webinar, okay? So anyone that joins on this webinar, this is not something I've done before. I'm going to send you this note, which you might think, oh, it's just a note, big deal. This is a sample note. It's 24 pages, I believe. Yeah, 24 pages. It's me as the patient. Okay, so we're not like doing any, violating patient confidentiality. It's me. And then Dr. Zach is my associate doctor. He went through and made a sample note of how we do a PI note. Now, I'll touch on this. We use ChiroTouch. We have this inside of our Move Now University program, where we actually share our note macros, done for you, training, all of that. That's something that requires a membership, because that's a ton of work into that. We can talk more about that later. But what I'm going to give everyone who jumps on this is I'm going to send this over to you, and you can see how we dialed in the documentation. This documentation is the end result of working with a compliance guy named Tom Nacella, who I paid probably $9,000-$10,000 over the course of a year to like audit and look at our notes and make sure that they're compliant across the board. Second one is Dr. Perry Barnhill from Fearless Chiropractor, who's also a compliance guy. He's gone through our notes. And then Dr. Cronk has also worked with us to make sure on the PI end that we put everything in there that was important on certain days. So for example, this is day one note, because this is a common question everyone's gonna ask. And right here, this is important. The following guidelines are those that we adhere to in our clinical practice. We list our guidelines, super important. Look at this right here. Due to clinical symptoms related to patients' injuries, along with specific orthopedic knowledge testing, I'm recommending films to be sent for CRMA, okay, which is we're sending them out to Spinal Kinetics to rule out ligament involvement, damage, failure suspected in this case. Excessive motion test is performed in order to determine the severity and location of any spinal ligament injury, okay? And then look at this. It's sent off to medical radiologists to have them measured and interpreted. The findings, if presented, are so significant that they're performed by an unbiased third party, all right? Look at this, gap in care. If there's a gap in care, we talk about it. I was injured, did not receive care during this lapse. Here's what he did, here's why, all right? And we go through this day by day, and you can just see how we flow this out. So this is a little added bonus.
Let me ask you a question.
Yeah.
6 months ago, if you had an injured patient, would your notes look like that?
For those pieces, no. There's very specific things that we've added into that we've learned from you, which have been huge.
Right. So and that's what keeps it simple. Now, to the doctor, that might look complex, right? But you could have an overview sheet or a final report that takes out all that complexity. That you need to have in your reports, though, so that when something to look something up or is challenging you on something, it's right there. That's beautiful, beautiful, Todd. Yep,
absolutely. Well, thanks. Yeah, so that's something that we'll throw in there. Now, here's the whole deal, okay? Here's how this works. And I know there's two camps here. Some of you are not members of Smart Injury Doctors, and some of you are not members of the Attorney Interactive Video, obviously, because you have to be part of Smart Injury Doctors to be able to know this stuff. So normally Smart Injury Doctors, to join Smart Injury Doctors right now, if you go to the site, if you go to Smart Injury Doctors, I'll just show you. If you went on and you said, I want to join this, okay, I want to get access to this program, get all this stuff. It's normally $4,999. It's a $5,000 program, and I'll tell you, it is worth $5,000. I'll also tell you that that back in the day, this used to be a little bit less, and you finally raised the price to, I think, where it should be based on all the stuff you put in it. I'm someone that designs programs. I know how much work you've put into this, and it is well worth $5,000 for it. Here's the cool part, is that you're not charging people $5,000 to join it, because a combo price on this is a little under $2,400 to have us build out the attorney interactive videos and for them to get access to Smart Injury Doctors. Okay, so lifetime access to Smart Injury Doctors. So all the stuff Dr. Kronk showed you, you have access to. No reoccurring fees, anything like that. And we build the attorney interactive videos for you. No reoccurring fees, anything like that. It's done. All the training's in there. And we even added, and this is something that I was willing to do, Dr. Kronk was willing to do, is we said what we even do is put a 3 payment option in there. So if someone wants to do 3 payments over 3 months, then how it works is you pay $897 times 3, but you get all the access now, and we start building this for you now, and you can start working on it, and you can start rolling this out in your clinic. Okay, now this page, this is the link that Dr. Kronk is going to put out in the chat. Is that right? Is that a way you can do it?
Yeah.
Okay, that's the one that I just emailed over to you, and that, and oh yeah, on this page. So a couple of things. In a second, I'll cover what happens if you're already a Smart Injury Doctor. Give me 1 second, I'll cover that. If you're not a Smart Injury Doctor, then this is the page you go to, so you get access to both. Okay. You could scroll through this page. You could watch all 5 of the videos in detail. They're all right here on the page, so you can click on them.
Let me ask you a
It
question.
shows you the first video, the second video.
Now I will,
It shows you the third video.
in this video, let's cover the top 5.
Okay, 4th video, 5th video. You get the picture. So you can go and watch. You can watch all of these, and then if you are already a member for Smart Injury Doctors, click over here, and then what it does is it basically subtracts off of this, and if you click here, it goes to this page. This is only for Smart Injury Doctor members, and then it's $1,400 to build out the attorney interactive videos for you. Okay, almost done. After you join this, it'll pop up on the next page, and it'll say, let me show you the physician interactive videos. You'll have an opportunity to get that, and I do discount it at that moment to give you a little bit of a incentive, of saying, okay, jump on that too. That's $589. So it's like half of the $1,400, less than half of $1,400, because if we build them both at the same time, it's a little easier for us, and we want to pass that on to you, so we charge you less. But then we also sample those physician interactive videos on the next page as well, so you can go through and see how that works. I will show you that page here. Hold. Is there anything that you want to say about that while I'm finding this last page, and then we can be done?
Well, I'll tell you what, when it says, doctors, when you're looking at these fees or this prices, if you spent $5,000 for my program and you spent $1,400 for the interactive video series that Todd's got, you're at $6,400, right? So you're getting this whole thing at $2,300, which is, but you don't need a lot of attention. Remember how I said your biggest thing is attention. Todd's out in the market right now, and all of a sudden he gets the attention, and he's not thinking about being an IME provider for the attorney, but in his conversation, the attorney learns that he's a much better doctor than the doctors that they have in the local area. So they need help because they know that they're damaging their ability to get the benefits that the patient may be entitled to because of poor, a poor workup. So now they become that attorney's workup source, right? So if Todd paid $2,300 to learn how to do that and he made $50,000, what is your ROI? Your ROI is insane.
Yeah.
I mean, if I said right now you can go get a stock and you could put $1,000 into it or $2,000 into it, and 6 months later you would have $50,000 in it, you all would mortgage your house to the hill to put it in.
And this is just fast tracking a process and putting systems into it. And it's something that we are doing week by week, real time, because my desire is to get about 40% of my practice, my patients, I want 40% of my practice to be injury work. Okay. And so the way I'm doing it is just like this, like the exact same way that we're doing it. So the cool thing is that we have a jump start on it. We've been doing it for a couple months and we're already seeing the success of it. And so because of that, we are then sharing and teaching, and we're a couple months ahead. So like if you jump on this now and you get into it, we're here as a resource to make sure that you're successful in it. You just follow the same steps. Now, that second page I was telling you about, it goes into the physician interactive video series, and how that works. You scroll on that page and it'll show all the language has changed speaking to physicians. That means I changed out the scripts and all the places that matter. Okay, so instead of talking about you left tens of thousands of dollars on the table, we talk about, you know, as you're aware of, 8 out of 10 Americans suffer with back pain and blah, blah, blah. And this is something you're experiencing in your office every day. So you can watch those here as well. Okay.
As you know, 8 out of 10 Americans have back and neck pain, and you're probably experiencing that reality every day in your office. Did you know some of the latest research points to the cause of these spinal issues to undiagnosed structural and spinal ligamentous instability that can only be detected through highly specialized examination and motion radiographic techniques? This may leave you with an incomplete assessment of your patient's true underlying and potentially disabling condition. This brief video series.
Cool. All right. And so it goes to the same thing. We had to change everything to make it work for a medical provider. So that's $589. If you choose to get it, you don't have to, but it's an option. And I'll tell you, the majority of our doctors that have already joined this got both, because they said, okay, it's a no-brainer. Great. This is my, my whole marketing plan for the next couple years / indefinitely, And so anyway, that's how it works, Dr. Kronk. Hopefully you were able to put that link up somewhere so people can see it.
I did. Can you see it? It's in the chat right now.
Well, I can't see the chat, so.
Everyone can see the chat.
Yeah. Okay. Yeah, I can see it. And if I click on it, it pulls it up. Cool. That works. All right, great. So it's in the chat. If you're watching this on a replay, then you'll probably see a button below on the page, and then that button below, click on it, and it'll take you back to the same place. And the whole special little bonus that we're doing is I'm going to give you a copy of those notes so you can use those, you can compare those, and you can see where you need to dial things in. And it's really taking the stuff inside Smart Injury Doctors, but it's helping you see it real life as well. And we have some pretty thorough documentation, like I said, that's been looked through by 2 compliance people and Dr. Kronk. And this is like our 50th version of it, and I'm giving you that refined version. So cool. Sound good?
Yeah, it sounds great. Okay, doctors. So basically what you want to do is you want to hit this link, you want to go out and you want to do this. Now, Todd, I think we should talk a little bit about the fact that this isn't forever. I'm not going to discount my program $4,000 forever.
Correct.
Right?
And on the same, well, that and on the same note, for us, I'm also not going to charge only $1,400 to put all these videos together forever either. So like, this is a thing that we're doing right now. And, I mean, pretty much with everything, after you intro it, then you say, okay, I'm going to make it a little bit more because, it's been out for a while. It's been tried and tested, and we keep adding to the training as well. So yeah, it's something where if you're interested in this and it piques your interest, especially the fact there's a 3 payment option now available, you can click on it. It'll cost you a little under $900 today. You get access to us building it for you, all the training going for us, all of Smart Injury Doctors. This is probably something you've never done before, as far as giving someone access to your whole program and doing it over a 3 monthly payment plan. Probably the first time.
No, you're the first.
There you go. I'm honored that you said yes when I proposed that. Okay, cool. Well, thanks for doing that. Cool.
So basically what you want to do, doctors, is you want to go out, see it, touch it more, watch the videos more, and then make a decision. And here's what I'm going to tell you, just a professional to a professional. The more consistently that you can start to just make a decision without chewing and chewing and chewing and chewing, the people that you attract are the people that you are. And I know that sounds like a really funny thing, but if you want people in your clinic, you want attorneys to make a decision with you just like that. You want to be able to, hey, they see you, I've interacted with you, and I'm gonna make a decision, and I'm gonna start to refer to you right now. You have to be that same sort of person. You have to be a person that goes, hey, look, I can see something, I understand it right away, this is gonna help me, this is a no-brainer, and you just make a decision. Don't stress out with the decision. Right? Think about it, think about it, think about it. The best investment that you can make, and this is not sales talk, it may sound like sales talk, the best investment you can make is in you. You're the one that has the responsibility to be successful for your family. You're the one that has the responsibility to be successful for yourself, your wife, your kids, your mom, your dad, your friends, whoever it is. There's no way that you can take this out and use it and not succeed with it. Impossible. Absolutely.
Yeah. A last thing that I'll say to that, because I've been doing Move now for 3 years, where we consult with other chiropractors. We're working with close to 160 clinics right now. So I've gotten to know a lot of different chiropractors, a lot of different personalities, a lot of different clinic sizes. And I'll tell you this, a couple weeks ago, for example, I reconnected with a guy who's got a huge clinic. It's like 15,000 square foot clinic. He's doing big things, right? His personality is he does big things, all right? And I was showing him what we're doing inside of Move Now University, the attorney interactive videos, smart injury doctors, all that stuff. It was like on a Saturday morning that he and I connected, and literally it was like, okay, cool, no brainer, let's do it. Okay, and it's funny because it's such a stark contrast to someone who's like, let me hoe and hum, let me build my list of pros and cons, let me wait until like this whole thing's obsolete because everyone else has already capitalized on it or something, right? And I'm not saying that at all in a condescending way of, I get that it makes sense to like logic and reason through things, or maybe you say, I'm the kind of person who just does that. No, don't define yourself as that kind of person. You can change it like that because in most cases, if you're that kind of person, and just be honest, if you're that kind of person, ask yourself the question, are you seeing the level of success that you want to see? And if you're not, shouting, yeah, absolutely, great. Okay, if you're like, well, maybe not. A lot of times it's because that spontaneity is what gets you to light the fire under you, to take the action, to run with it and put it into place. I have always been compulsive in that way. Okay. Sometimes that's not good. I get that. Okay. There's certain parts of life where it's not good, but I'll tell you, in the areas it's been good, has been in practice, has been in learning new things and implementing them, because it's just how I'm wired. I can't help it. I just have to do it. And in working with all these other doctors, I've seen many other doctors who will admit that they're not like that. That's not me. And they learn those new habits and they take a little bit like a leap of faith and they start doing it and they start repatterning that and they see more success. Okay.
Right.
So
let me actually just add one, since we're having fun. Some of you are still on. I see there's a lot of doctors that are still on listening to what we have to say. I'm going to add one other thing. You're not spending your money anywhere. And I know that's going to sound totally foreign to you. When patients come and give you their money, you're using their money to buy it, not your money. You're just exchanging. You're just exchanging it and you're passing it through. It's not even your money. It's their money. You're using other people's money to buy this program, not your money.
I like that idea.
You know what I mean? The more you understand that, the easier it is. I mean, Todd and I were talking earlier, and in the last year, just in my own development, learning, mentoring, paying for services to help me along so that I can actually get in a helicopter and be at the head of a country and do all these various things, I probably have spent somewhere north of $80,000 to $90,000 last year. Right. So in improving my ability to get our message out, I got big goals, and I want big reach, and I need big attention. Now, I'm not suggesting you go out and spend $90,000, but what I am saying is that one, it's not your money, it's just passing through, and just make a decision on this stuff. If you're a good doctor and you're really good at what you do, you should be loaded with injury patients. And I'm telling you right now, the biggest problem you have if you're not is you don't have enough attention in your market. You are not getting attention. This is a key tool to get attention. And then the tool behind it, the Smart Injury Doctors Program, is a key tool to having you keep the attention once you have it by becoming, you know.
Hey, also too, I'll just tell you guys, as I'm sitting here right now, I get the notifications. There's doctors joining right now. I'm not going to give like last names or anything, but Dr. Paul just joined right now. So awesome. We'll get stuff sent over to you. When you fill out your stuff, you'll get automated emails. And so, yeah, like, please, if you have questions right now, ask the questions, because we're not in a hurry to jump off. I mean, we'll stay on here and answer questions as long as you have questions. So ask questions.
Yep. One thing. So finish up with the fact that when does this end?
Gotcha. Yeah. We're doing this Monday evening is when, so from this, what we're going to do is send out a replay, and that's going to basically be up until Monday evening. So it gives you today, which you can jump on it now if you want, tomorrow, and then Monday. I know tomorrow's Father's Day. Happy Father's Day to all the fathers out there. But Monday evening is when we will shut this down. So either just jump on it now, or if you want to build your list, you know, the pros and cons, or, you know, part of it I think is this, is that you've bought stuff in the past and you haven't used it, right? You've bought stuff in the past and you let it sit on the shelf and collect dust. I will not let you do that. So meaning I am here as a resource to push you to use this thing. So if you get it, you're going to use it. If you get it, find your staff. I'll hook up your staff with my marketer, Kate. She'll talk to them. She'll motivate them. Any problem you can think of, we have a solution for it. And Dr. Kronk has tons of engagement with all the doctors inside Smart Injury Doctors. He's relentless. I have not met anyone else, I think, that works as much as I do. I think that you work more than I do, actually. I think you do. Maybe.
I think we're pretty compatible there.
Okay. And the fact that Kronk and I have hooked up and we're working together, if you need something on this, we're here for support. Okay. So it's just throw it out there. Is there a reason why you're looking at this and you're maybe hesitant to think it won't work?
Well, just throw it out there. Throw it in the question box. Give me some, like, what would be a why you wouldn't do this, or what else do you need to see, or what else would you need to know? If there's anything like that, just go ahead and throw it right up into the questions box.
Yeah, and throw it out there, say it, no judgment, just say it so we can start the conversation and we can handle it. We can try to handle any sort of concern or objection you have.
Here's a question. Hey, there's a 3P option for the doctors that don't have the Smart Injury Doctors Program? Is there a 3P option for the doctors that are in the Smart Injury Program that are already in it? So they saw the 3P option. For
Gotcha. And they want to get access to the Attorney Interactive Video and want a 3 payment option. You know what? I don't have something put together, but I'm not opposed to it. So if I put it together, I'm gonna charge a little bit more. Okay, I won't charge a ton more, but you know, I'll figure out the math and I can put a link together for you on that. So shoot me an email. It's Dr. Todd, so DRTODD @movenowu.com. So maybe you could put that in the chat, Dr. Kronk. Just drtodd@movenowu.com. Let me know. They say, hey, I want to do it, but if you can put a 3 payment option together, and what I'll do is send in some kind of link for you. So if anyone's watching this and you want a 3 payment option, by the time you're watching this on a replay, I'll probably have that option on the page, because if I'm gonna offer it to one person, I'll just offer it to everyone. I have not done that before either on this, okay? Because this is only the second time that you and I have talked about this in front of the group. as far as on a webinar. And so
Yeah,
it's kind of a spur of the moment thing.
I tell you what, the other thing is, and this is a thing that this is lifetime doctors, right? So what you're going to be able to do is this material that you're getting access to is going to be material that translates into injury, what the market needs for the injury area for the next decade, right? So it's not something that you go, oh, geez, I'm going to use this, and if I don't use this next month, I've got a problem. You're going to use this over and over and over for years to come,
Yep.
So just like Doug Schmidt, you know, the attorney that I did that clip. I mean, he's now 5-6 years later, he's actually giving lectures at the chiropractic for CE. He's an attorney giving CE on radiology. Right now, he uses that information over and over and over again. What he didn't tell you about was he didn't talk about what that means when he goes to court. Todd, what do attorneys like to? What do they talk about when they go to court? What's the number one thing? Settlements.
Yeah.
Okay. They equate how they did to the settlement numbers. If Doug Schmidt, if he actually gave the numbers, you'll drop your jaw, right? So he's using this information over and over and over and over again. If I were to ask Doug, how much has this increased your lifetime earning potential? Now remember, the older you are, the less lifetime earning potential you have. Todd Pickman, he's got a much higher lifetime earning potential right now if we're doing the same thing and we're starting than I do, right? Because he's got more life.
Yeah, and a key thing to specify here is that, and something that we communicate with the attorneys as well, and Dr. Cronk talks about this in his entire program, which is what makes it so appealing, is that we're not sitting here and going, here's how we're going to make this settlement so big for you, because what does it mean if someone has a huge settlement? It means that they're really screwed up and they have a bad injury. That's not good for the patient. So like it's on one end, the attorneys need to be able to get their client access to benefits they're rightfully entitled to. If they don't have a doctor that's doing their job, they're missing, it's screwing over their client. Us as the doctor is screwing over the patient. Okay, so, but that's not what we lead with ever. It's never like, here's how we're gonna get you the most amount of money. It's access to benefits rightfully entitled to, but we're gonna do excellent diagnosis and clinical work to help them for a lifetime. This is where you, Mr. Attorney, are going to want to send your daughter or your wife if they have a trauma, so that you know that they're getting excellent clinical care. So that's the way we position this, because that's the truth.
Absolutely. Absolutely. All right. So we're live. If you've got anything else, I'm not seeing other than a couple of clinical questions. You know, about how ChiroTouch works, things like that, which we're not really going to touch on. How much for the attorney interactive videos only? I think you showed that.
Yeah. So I just got an email from Joe. So Joe, on this link in there, scroll down a little bit, and if you're already part of Smart Injury Doctors, you click here. Okay. So keep in mind how we have this set up. This whole thing that we're building, it is only for Smart Injury Doctors. Why is that? Because everything in the videos is explaining the details that Dr. Cronk teaches. We're doing this for quality control to make sure that everyone has access to the training and doing these things. I'm assuming that you're part of Smart Injury Doctors. So you just click here, and then it gives you this, and it's already a member, and it's $1,400 if you're already a member. So basically what you're getting is access to Smart Injury Doctors for $997. You know, as far as what Dr. Cronk did, he took off about $4,000. All right. And that's basically how it splits. Okay. Good question. Are there any other questions?
Just kind of going through.
Still got a ton of people on here live, so we'll stay on until we see the numbers trickle down. This might be a record breaker long webinar, but that's okay.
I understand. How should chiropractors get started with this work? Buy the course and log in just like Todd did. And
Yeah, I think it's you log in, you have us build the videos, we'll start on that, and immediately you jump into Smart Injury Doctors and you go through the whole first section. That's what I did. Is I went into Smart Injury Doctors, I went into the first whole section here, which is I'll just show it. I'm still sure. Hey, am I still sharing my screen?
yeah.
Okay, cool. So I went in here. This is what I did. I went in to the Smart Injury Doctors training program, and I just started on the very first one. Welcome to Smart Injury Doctors Spinal Ligament Program, how it's laid out. You join the Facebook group, and then literally you just start going through this stuff, and it's honestly it's fun stuff to learn. Like, it really scratches that itch of the stuff that you want to know. All the questions everyone's asking here, it goes through it methodically. It makes you want to learn more. Talk about mechanism of injury, talk about, main terms to understand. You just start going through it, and it'll take you a couple days to go through it as far as to really grasp this well, but jump into it. And, on top of that, if you have questions, you go into the Smart Injury Doctors Facebook group, ask a question. And that's what I did, is I went through it. I'd ask a question, I'd get a response. And, but there's not a ton of questions you have if you just run through this in sequential order, but all the support's there. So that's what I would do.
Okay, let me see. Okay. You know what, Todd? I don't really see any other questions involved with, hey, this is something that would, is hold me back, or, hey, here's my consideration to handle. I think we've done enough for today. Doctors, you have, is it 8 hours, 58? No, it's
no.
Yeah,
that's just a little like automatic timer that's on this page. But
Monday.
As far as keeping this whole thing active, this will be active until Monday evening. We're doing 10 p.m. Mountain time, so 12 Eastern, 10 p.m. Mountain, and then that's how long we're going to put this together for. And then also, again, everyone that joins this, we already had a bunch of doctors just jump on. I'm getting the messages on my end. I will email you over the copy of those notes as well, so you have those. So reach out to me if you need anything. You guys have my email, drtodd@movenowyou.com.
Yep.
Cool. Look at that. We hit 2 hours. We hit 2 hours.
We hit 2 hours. I guess the last thing I just want to kind of share is you got to have the foundation. You got to have the see, what's that old saying about practice and preparation? Practice and preparation means, when those two add up together, it means opportunity. There's a quote, I can't get it in my head right now, but the bottom line is you have to prepare to be successful. So right now, doctors, if I said to you, look, I can introduce you, just like I showed you on the original video. Sorry, I took it away. I can introduce you to somebody that has the potential of giving you 30 to 100 personal injury patients a month. Are you prepared for it? Right? So when I put you in the room with that group, how are you going to do? So if you haven't sat there and you haven't swung a bat 10,000 times and you haven't worked on hitting, and now you get the opportunity, and if you can hit, you may pick up a pro contract. All right.
Hey, I think too, I hit some button to take off the screen. I thought it was going to show us. I'm not sure if it's showing us. You might want to take back over so they can at least see us talking as we're closing this out.
So what I'm saying there is that, hold on, show my screen. Okay, so all I'm saying is that if you, you're sketchy, you're a little bit like iffy on your understanding of things, on your ability to keep it simple, on your documentation. I mean, documentation complexity, there's only 5 things you really need to focus on. When you're misunderstanding. So if you're not prepared if you don't actually prepare, you will blow your opportunity. One, if you're not prepared, you'll never ever see it. Then that's the big takeaway for today, doctors. If you don't prepare and you don't start getting out there, you will never see the opportunity that's out there. If Todd was not out in the last 2 weeks, a month, doing this, and when I say out, first he was in because it was all done inside because of COVID-19, and then now he's starting to get out. He wouldn't have saw the opportunity for IME, plaintiff IMEs. And that's on the plaintiff IME side. That's not on the injury where they're sending straight over the patient to him. He never would have saw that. The more he's out in the market, the more he's going to see. He's going to run into the top orthopedist. He's going to run into, but all of his interaction getting to the point of meeting that top orthopedist is going to make a huge difference on when he meets that orthopedist, that now he brings that person in as well. So this all accumulates as it goes. It makes you more and more competent in the market, bottom line. Okay, Todd, we're going to have to get off of this. We are longer than I thought.
That's awesome. Well, you know what? We had a ton of people on here. We still have a bunch of people on here live right now. So obviously this is a topic people are interested in.
One other question. I have multiple offices. Do I just buy one program? My answer is yes.
Yep.
So you might have to, you may have to talk to Todd individually on if you need to set up an individual program for each. He may have a slight additional fee, or he may have additional fee because he's got to go in and customize it to each different clinic. But the answer is generally yes.
I can definitely work with you on something. So if it's the same clinic name and it's the same provider, or we can figure out a way on the video to introduce everyone collectively, then we can definitely build it so it will cover all your clinics.
Yep. Okay, good.
Cool.
Todd, I appreciate you doing this.
Awesome. Yep. Thank you. Thanks for everyone who attended. It's great to have so many doctors on a Saturday morning for so long, for going on 2 hours. But I mean, this was like, it was a good training. I think there's a lot of cool things you touched on that sparked a lot of, oh, okay, yeah, that is a question. And just know those answers are inside of Smart Injury Doctors. So, and if it's not, talk to Dr. Cronk, reach out to him. That's what I've done. I bugged him enough. He knows.
Right.
Right. He's like,
yeah. No. It's never bugging. It's bugging long term. Listen, I'm going to tell you right now, doctors, Dr. Pickman got my attention. Like, will I do that with every single doctor? Absolutely not. Absolutely not. Now I'm just being who I am. He's going to be who he is. I'm going to be who I am. Why? Because I don't have time. Right? I want to be with GE. There's big projects that I have. So I don't have a lot of time. But when somebody gets my attention, and how do you get my attention? You get my attention by applying my material. And now you're succeeding with it, but you're stumbling a little bit. Good. You got my attention.
Yeah.
You know what I mean?
Yeah. But you know what? On that same note, there's so much support inside of your Facebook group because there's so many other doctors who've been with you for so long who jump on and answer questions before you even get a chance to. So
yeah.
So anyway. Yeah. Cool. Awesome.
Okay.
All right. Well, we're ending it. I almost feel bad ending it when we got so many people on live still.
I understand. We do.
Okay. All right, everyone. Well, thanks for hanging out. For all the fathers out there, happy Father's Day tomorrow. And we'll send out a replay. You're probably, well, if you're watching this now, you're watching this on a replay. That's like Inception, right? The future.
Yeah, really. Really, yeah, really.
All right, cool. So there'll be a button below on the page if you're watching this as a replay. Click that and you'll be able to get access and join. There we go.
All right. Thank you.
Cool. See you.